critical that we're working not only with at-risk communities, but also that we're doing that in conjunction with religious leaders. And the reason being because there's a lot of fear out there, and when we talk to people about their fear, there often is a religious theme to people saying that they're not going to take the vaccine. And in talking with a lot of these religious leaders, the approach that they're taking is we need to fight against the fear of the vaccine, because the reality is that the vaccine is a way for us to keep our communities healthy and not being afraid and not be in fear of COVID-19, because we do have a vaccine that's both safe and effective that can help protect our communities and get us back to normal. And the churches in particular, high concentrations often of very at-risk populations, particularly the elderly, and being able to get back to normal. The churches certainly want to be able to go back to holding in-person services without fear of what's going to happen. And so that's a great partnership to pull those together and really target some efforts, particularly at at-risk individuals.
The biggest medical triumph of really the century. I mean, we haven't had anything like this since the 1918 pandemic, but really, what people don't realize, what a breakthrough these vaccines were, these messenger RNA vaccines. These have been in development for 10 years, but they've never been rolled out and shown to work. Well, here you had two vaccines that were shown to work, and it's an incredible tour de force. I mean, to do a clinical trial that quickly, for someone that does clinical trials, I'm just totally floored by it. How quickly they enrolled, how quickly they did the clinical trial, and the quality of the data.
The more people that you can vaccinate and build up some type of adaptive immunity from the virus using the vaccine, then it can stop, spreading it to this person, that person, someone who's very vulnerable.